Chapter 3. Benefits to the human body. Welcome to our channel. Food as medicine. You are what you eat. Obesity, a weight loss journey. As discussed in previous chapters, obesity is now a major concern globally due to its rising complications. This disease was a major issue in developed countries, but it has become alarming in underdeveloped and developing countries. The facts given by the World Health Organization, WHO, from 1975 to 2016, obesity and overweight in children and adolescents of ages 5 to 19 years has increased fourfold from 4% to 18% worldwide. According to another survey in 2016, there were 1.9 billion adults who were overweight, while 650 million adults were living a life of obesity at that time. Now in 2021, this amount has been doubled or tripled. In most countries, obesity kills more people in a day as compared to being underweight. What is it? Obesity and overweight are a large amount of fat accumulation in different body areas that may be proved fatal to human health. Fat is either present under the skin, known as subcutaneous fat, or visceral fat around the body organs. In males, excess fat is usually accumulated around the belly region, making their body apple shapes, while in females, fat is present around their buttocks, pear-shaped. Men are at a greater risk of developing serious chronic illness due to their apple-shaped bodies because the fat affects the function of their body organs and may accumulate in them. Experts believe that losing even 5% of total body fat may reduce the risk of developing obesity-related illness to a considerate level. When we eat food containing a high amount of saturated fats and sugars, our body stores surplus energy in different areas due to lack of physical activity. Obesity does not come suddenly, but it develops gradually. Before you commence, it is important to measure body weight, height, and waist circumference accurately. This is called anthropometric assessment. It refers to the measurement of an individual's size, dimensions, and body composition. These measurements can incorporate proportions of muscle and fat tissue. The most common anthropometric assessments performed are weight, height, and waist circumference. Achieving and maintaining a healthy weight is essential for overall health and lowering the risk of some chronic diseases such as heart disease, stroke, diabetes, and high blood pressure. Accurately measuring your anthropometrics can tell you a lot about your health risk. BMI stands for Body Mass Index. It is a simple method to indicate body fat content and classify underweight, healthy weight, overweight, and obesity. Both height and weight measurements are required to calculate BMI. There are slightly different cutoffs for different ethnicities. The cutoffs in the table below for underweight, normal range, overweight and obese classes I to III. BMI is used to estimate the proportions of a population in various weight status categories and is a less accurate estimate of body fatness at the individual level. Height is a measure of vertical stature or how tall you are. Like measuring weight, there are different units of measurement for height. Using the metric system, height is measured in centimeters, cm, and in the imperial system, it is measured in feet and inches. Human height is the length from the bottom of the feet to the top of the head. For the most accurate measurement, shoes and any hats or hair ornaments should be removed. The person being examined should stand against a wall with the back of their head touching the wall. Look straight ahead. Feet should be placed together, and heels should also be touching the wall. Weight is a measurement of a person's body mass. Body mass can be measured using different units of measurement. It is usually measured in either kilogram, pounds, lb, or stones and pounds, street and lb. The unit of measurement will vary depending on where you live in the world. Weight should be measured using a set of scales that are suitable for measuring body weight. Waist circumference is another predictor for the potential risk for developing chronic diseases such as heart disease, type 2 diabetes, and high blood pressure. Measuring waist circumference is a simple check for excess abdominal body fat, also known as visceral fat. Carrying excess body fat in the abdominal area is riskier than body fat stored around the hips and thighs. Role of calories. Calories are basically known as the unit where we measure the amount of energy needed or expend through our body. An average person needs 2,000 to 2,500 calories per day depending on various factors like age, sex, and activity level. If a woman is pregnant or lactating, she needs to take 200 to 500 additional calories. Calorie requirement is also increased if there is any injury or trauma. In these cases, the body needs extra energy to repair itself. In terms of obesity, if a person consumes more calories than the requirement, these extra calories will become a cause of obesity. Fast food and junk food are very high in calories that they can make 1,000 or 1,500 calories in one meal. These extra calories are then stored as fat in our bodies. There can be several reasons for obesity. Some are discussed below. Bad eating habits. The benefits of a clean and balanced diet are already discussed in Chapter 1. A clean diet can make you healthier and more intelligent. If we have bad eating habits or poor diet, it results in malnourishment. Either a person will gain weight, obesity, or lose weight terribly, underweight. This diet includes ingestion of highly processed food frequently. This food is high in saturated fats and also in sugars. Both of these are obesity-causing agents and may lead to many other obesity-related chronic diseases. The food we eat is mainly comprised of 3 macronutrients: carbohydrates, protein, and fat. All of these are broken down into glucose through proper mechanisms in the body. Processed foods are high in sugar and create a glucose spike in the blood. It signals the body to store extra calories, glucose, in fat, making us gain weight. Processed food is depleted in nutrients and contains simple sugars. They also have a lot of preservatives and other chemical compounds which are harmful to the human body. Our food intake is affected by season, availability, religious beliefs, convincing marketing strategies, and the advertising techniques used to tempt us to make us feel hungry even when we are not. Awkward eating timings. Some people are habitual to eat even though do not have hunger. If they are anxious or feeling depressed, they eat food without thinking of their ability to eat or health. Alcohol drinking. Drinking alcohol in excess and frequently will make you gain weight because alcohol has many calories. Sweetened beverages. Drinking sugary and sweetened beverages can rapidly increase your weight and ultimately make you obese because these beverages contain a high amount of sugars that promote obesity. Sedentary lifestyle. According to the recommendation of the Department of Health and Social Care recommendation, adults should exercise 30 minutes daily and 150 minutes a week. In a recent era, people are habitual of working in offices at their chairs and desks. If they want entertainment, they prefer watching TV or mobile screen instead of badminton, cricket, tennis, etc. Participation in physical activity is influenced by many factors, including long work hours, family commitments, and cost. Beyond these factors, other psychological and a wide range of social factors affect how we eat, how much we eat, and how often we engage in physical activity. It is not only specific exercise sessions that are important to incorporate into everyday life. There are also many benefits to making your usual daily activities more physically active. Examples of how you can incorporate exercise into everyday life. Take the stairs instead of the lift or escalator. Make your travel more involved. For short trips, walk, ride, or skateboard instead of the car park further away, so you add in extra walking time. Take scheduled activity breaks from your desk to go for a short walk. Do more housework or gardening. Stand while talking on the phone. Walk around the house while brushing your teeth. Consequences of obesity. Obesity is estimated by body mass index, BMI, which was discussed in earlier chapters. If BMI exceeds 25 kilograms per square meter, a person is then categorized as overweight. While at 30 kilograms meter per square, obesity starts. In 2012, many deaths occurred due to heart attack and stroke, will be discussed in earlier chapters. It was due to obesity that gives rise to cardiovascular diseases, CVDs. When fat deposition occurs in arteries and veins, blood circulation stops and results in myocardial infarction or heart attack. The other major prevalent disease is diabetes, in which the body is unable to make efficient insulin for the proper functioning of the body. Obesity is its main cause. Obesity can cause musculoskeletal disorders like osteoarthritis, a disease of joints in which joints are degenerated and do not function properly. It can also cause cancers like ovarian cancer, liver cancer, prostate cancer, breast cancer, etc. These diseases are most common in obese men and women who lack physical activity and have poor diets. The main thing to ponder here is the prevention or treatment of obesity through healthy and particular diets. Diet for obesity, weight loss. When it comes to losing weight, the first and foremost thing should be to set a target for their weight loss. We often think about the big picture: I want to lose 20 kilograms weight. There are diverse beliefs about whether setting long-term weight loss goals may be beneficial or not, or decreasing motivation and leading to weight loss failure. However, setting short-term goals may help you to achieve the target weight loss. Common features of successful weight loss programs include encouraging people to eat breakfast every day, cooking meals at home, decreasing portion sizes, promoting food from all 5 health food groups, including whole grains, fruit, vegetables, lean meats, chicken and fish, legumes, nuts, and reduced fat dairy. DASH diet is mainly developed for patients with hypertension, but researchers have found its benefits in reducing obesity. This diet focuses on fruits, low-fat dairy products, vegetables, and some lean protein products such as beans, chicken, and fish. This diet restricts the intake of red meat, sugars, fats, and especially sodium. At the same time, it is high in potassium, calcium, and magnesium. This diet helps in weight loss as it is low in sugars and fats, the major factor of obesity. It also helps lower the risk of cardiovascular diseases, type 2 diabetes, metabolic syndromes, and reduced pulse wave velocity. In October 2003, a controlled trial was performed in which 144 people were randomized to study the effect of DASH diet alone, DDA, and DASH diet on weight management. Both were given a diet with high dietary fiber with fewer salts, sugars, and fats. At the same time, the group of weight management was provided with an exercise plan. It was observed that the group with DASH diet alone, DDA, had less reduction in blood pressure and weight, while the weight management group had better results than DASH diet alone, DDA, group. This diet is low in fats and sugars while high in dietary fibers. This helps us to reduce appetite, and as a result, we achieve weight loss. This diet increases our satiety because of fiber. This diet meets the needs of 2,000 calories per day, which are inappropriate for efficient weight loss. If anyone wants efficient weight loss, then there is a need to restrict calorie intake. This can be done by making good and healthy choices with fewer calories. The other way for weight loss with this diet is to do exercise regularly. A trial was performed in which one group was provided with low-sodium vegetable juice while the other was provided with just diet counseling. The group with low-sodium vegetable juice experienced weight loss. This shows that only the DASH diet can also help in preventing weight gain. Hypertension. In the condition of hypertension, the pressure of blood rises in the body, which shows abnormal conditions in the body, like headache, fatigue, chest pain, irregular heartbeat, etc. You can get further details on hypertension in Chapter 2. Cardiovascular diseases, CVDs. It is a condition in which heart and blood vessels are affected due to the accumulation of fats in blood vessels, or sometimes clotting occurs in blood vessels. These diseases are mainly related to a process called atherosclerosis. Some parts of the heart muscles die because blood flow stops due to clot formation. Cardiovascular diseases refer to heart disease, heart attack, stroke, heart failure, arrhythmia, various heart valve problems, coronary heart disease, deep vein thrombosis, and several blood vessel diseases. Symptoms of heart disease vary among males and females. Males are highly likely to have chest pain, while females have nausea, fatigue, and shortness of breath. A heart attack usually occurs when the blood supply to the heart gets disrupted. It is primarily due to the plaque formation in the arteries of the heart. This clot blocks the normal blood flow, and that particular part begins to die. Most people survive their first heart attack and live several years enjoying their life. But experiencing such an event means that you should pay special attention to your lifestyle. These medical and lifestyle changes vary with the possible damage to the heart and vessels. Stroke, just like a heart attack, is the disrupted blood supply scenario. But stroke is the blockage of the vessels supplying blood to the brain. This blockage is again caused by clot formation. When the blood vessels get blocked, that part of the brain gets deprived of oxygen and dies. This is called an ischemic stroke. When a part of the brain is affected in this way, all the functions of that particular part of the brain are lost due to oxygen deprivation. On the other hand, hemorrhagic stroke occurs when the blood vessel supplying blood to the brain gets burst. This type of stroke is due to high blood pressure, hypertension. Sometimes, the brain becomes permanently injured. There is no way to replace or treat that part of the brain. But in some cases, the brain only gets temporarily injured, and the function gets normal after some time. Heart failure, also called congestive heart failure, occurs when the heart cannot pump the blood properly. It does not mean that the heart does not pump blood or the heart stops working. It simply means that the heart does not meet the body's blood and oxygen requirements. It can get worse if it is left untreated. Arrhythmias occur when the heart does not beat in a normal manner. It either beats very slowly or very fast. If it beats very slowly, this situation is called bradycardia. On the other hand, if the heart beats very fast, this is known as tachycardia. In both cases, the heart's function gets disturbed, and it cannot pump blood properly, due to which body parts get deprived of oxygen. Without oxygen supply, tissues begin to die. Symptoms of heart arrhythmias include chest discomfort or pain, fainting, lightheadedness, fluttering in the chest, and shortness of breath. Deep vein thrombosis is a condition where a clot is formed in the legs. It can damage the blood vessels and may move to the other body parts, leading to severe damage. The human heart has 4 valves: mitral, bicuspid, pulmonary, and tricuspid valve. These valves are responsible for opening and closing the passageways of blood flowing through the heart. Different factors may raise or lower the odds of a person's having a set of these deadly diseases. These include an unhealthy diet, physical inactivity, smoking tobacco, harmful alcohol use, high blood pressure, high blood glucose levels, raised blood lipid levels, obesity, or overweight. Studies show a range of risk factors that can or can't be modified. The factors you cannot control are age, gender, race, hereditary. People who suffer from heart diseases are usually aged 65 or older. Heart attack can affect both males and females, but females are more likely to die than males. Males are at a greater risk of having a heart attack, and they have heart attacks earlier than females. Cardiovascular diseases, CVD, are the leading cause of death worldwide. Research shows that a diet high in FR, fruits and vegetables, fiber, polyphenols, vitamins, minerals, and low in saturated and total fats lower the risk of the onset of cardiovascular diseases and their progression. Dietary approach to stop hypertension, eating pattern mainly focuses on fruits, vegetables, low-fat dairy products. This dietary pattern only allows the healthy food items. A study signed about 21,000 women to diet has significantly reduced hypertension and cardiovascular diseases risk factors, LDL. This dietary approach is helpful for hypertension obesity, but it can lower the risk of the initiation of cardiovascular diseases. Moreover, a decrease in blood pressure rules out the incidence of hemorrhagic stroke. Another risk factor is blood cholesterol levels, LDL and HDL. LDL is the bad cholesterol, while HDL is the good cholesterol. LDL plays a key role in plaque formation in the arteries. This plaque may restrict the blood flowing in the arteries and raise the risk of developing a wide range of heart diseases. Diet aims to lower fatty food items and replace them with healthy food choices. This, in turn, may lower blood cholesterol levels and high blood pressure. Diet is a heart-friendly diet. Managing blood pressure can make a huge impact on heart health. High blood pressure can damage the arteries, block them, and prevent the blood from flowing normally. It may also lead to stroke, kidney failure, and vision loss. Maintaining a healthy weight is another point to focus on. Eating patterns can help you to achieve a healthy body weight. Weight loss on this diet is accomplished by high fiber, protein, and good quality carbohydrates content. Dietary approaches to stop hypertension. Eating pattern is packed with all the protective cardiovascular nutrients, i.e., fruits, vegetables, dietary fiber, unsaturated fatty acids, poultry, fish, NA, Mg, Ca, K, whole grains, low sodium, less saturated fat, less processed and refined food products. The benefits of this diet, are not limited to hypertension. Still, studies have also reported other health benefits of this diet, like improved LDL levels, stroke, diabetes, weight management, insulin sensitivity, total cholesterol, inflammation, and other cardiovascular diseases. This diet is recommended by the health institutes, ADA, AHA, and NIH, and is packed with potent compounds like antioxidants, polyphenols, and phytochemicals. Due to their antioxidant property, polyphenols may help reduce inflammation, a significant risk factor of heart disease. They may also lower the risk of blood clotting. Polyphenols may also improve memory and learning. Dietary approaches to stop hypertension, is a flexible and balanced diet. It requires no special foods or food supplements, and combining it with other lifestyle modifications like being physically active, quit smoking, and getting good sleep can provide additional health benefits. Type 2 diabetes. Diabetes is a chronic medical condition. It affects how our body turns food into energy. The food we eat is broken down into glucose in our body, then released into the bloodstream. This glucose surge signals the pancreas to release insulin. Insulin is an anabolic hormone that stores the extra calories, glucose, into the body cells. In diabetes, the body either fails to produce insulin or there is insufficient insulin production. In both cases, there is a disruption of energy regulation. When there is not enough insulin or the body cells do not respond to the insulin properly, glucose levels rise in the bloodstream, and it can cause severe impact on our health such as vision loss, heart disease, and related problems. Diabetes is the #1 cause of kidney failure. Nearly 34.2 million U.S. adults have diabetes. Although there is no specific cure for diabetes, it can be managed by simply inducing lifestyle changes like losing weight, a healthy diet, and checking blood glucose levels regularly. There are 3 main types of diabetes, i.e., type 1 diabetes, type 2 diabetes, gestational diabetes. In this section, we'll focus on type 2 diabetes. Diabetes type 2 is the most common type of diabetes. More than 90% of diabetic patients have type 2 diabetes. It occurs when your body either makes enough insulin or cannot use the insulin properly. As a result, too much glucose stays in the blood, and the body's glucose stores become deficient. It can occur at any time of life, even in childhood, but most affected people are middle-aged or older. Some have a family history of diabetes. Others have high body weight. Some ethnic groups are more affected than others. For example, African Americans, American Indians, Asian Americans, Hispanics, or Latino more commonly develop diabetes than any other group. Some other risk factors need special attention, and physical activity is one of them. Other than that, high blood pressure also plays a key role in developing diabetes. Diabetes is still the 7th cause of death in the United States. Most of them, 1 in 5, diabetic patients don't even know that they have diabetes. The most common symptoms associated with diabetes include increased hunger and thirst, fatigue, blurred vision, tingling and numbness of hands and feet, unexplained weight loss. It is to be noted that these symptoms develop very slowly, i.e., over several years. Others have mild symptoms. Some don't even have any of these symptoms, and they only get to know when they have diabetes-related health problems. When it comes to the point of what causes type 2 diabetes, there are multiple factors involved. These include being overweight or obese, insulin resistance, genes, or physical inactivity. Diabetes type 2 can be managed by intensive lifestyle changes. These include weight management, dietary modifications, physical activity, and regularly monitoring blood glucose levels. Losing extra weight is essential for a diabetic patient. A weight loss of 5% of the total body weight is recommended. If weight loss cannot be achieved, a healthy eating pattern is encouraged to prevent further weight gain. Dietary modifications also play a key role in reducing the risk of type 2 diabetes. A high in whole grains, fruits, vegetables, and nuts are recommended to a diabetes patient. In addition, a person should limit their fat and sugar-sweetened food items consumption and keep their blood lipids and glucose levels in the normal range. Lifestyle modifications are as much necessary as any other intervention. 150 minutes of physical activity like brisk walking is recommended every week. Being physically active makes the body sensitive to insulin action to some extent. The treatment of a diabetes patient is initiated with nutrient therapy and lifestyle modifications. The fundamental and primary objective of a diabetes care plan is to keep the blood glucose levels in the normal range. Hence, it is suggested to keep the glucose levels as close to the normal ranges as possible. Nutrition therapy can improve our blood glucose levels and may impact the overall health status of a diabetes patient. Nevertheless, the personal preferences and eating habits of the patient must be considered. For this purpose, a registered dietitian can design a good eating plan for you based on your needs. The recommended percentage of macronutrients, i.e., carbohydrates, protein, and fats, depends on factors like food preferences and metabolic factors. The carbohydrates we consume have a huge impact on our blood glucose levels. It varies among individuals and is based on glucose tolerance, body weight, and blood lipid levels. Glycemic control is also essential. Different foods impact differently on our blood glucose levels. For example, white rice may raise glucose levels much higher than a similar portion of barley. Glycemic values of a type depend upon the type of carbohydrate present in it. Simple carbohydrates can cause glucose spikes and can cause glucose sugar. For this reason, complex carbohydrates are recommended to a diabetic patient. These include whole grains, fruits, vegetables, and other high-fiber, low-processed foods. Dietary approaches to stop hypertension. Eating pattern focus on healthy food choices. Fruits, vegetables, and whole grains are excellent sources of dietary fiber, which greatly impact digestion and fullness. It slows down the digestion of carbohydrates present in our diet and releases glucose into the bloodstream gradually. People with diabetes are encouraged to consume food items with high fiber content to improve glycemic control. Protein is another micronutrient. Several small studies show that protein intakes, i.e., up to 28% of total kilocalories, may improve blood glucose and lipoprotein levels. But high protein content is discouraged for a diabetic patient because it may hurt kidneys and harm a patient with nephropathy. DASH's eating pattern is low in dietary fats and focuses on high-fiber foods, unsaturated fats, and complex carbohydrates. Lowering the fats and promoting good quality carbohydrates can improve blood glucose levels and give you more energy. The DASH eating pattern is widely acceptable. It has a huge impact on many biological parameters such as insulin resistance, blood glucose levels, hyperlipidemia, hypertension, overweight, or obesity. The DASH eating pattern was first developed as a systematic approach to control high blood pressure. People with diabetes are at high risk of developing hypertension. So it is quite reasonable to use this plan for both hypertension and diabetes. Stroke. Stroke, ischemic or hemorrhagic, is a condition of impaired blood flow to the brain tissue. It is the 7th leading cause of death in the United States. About 87% of cases are ischemic stroke, and the remaining 13% are hemorrhagic stroke. It may cause severe brain injury and affect the entire brain function. Hemorrhagic stroke may cause bleeding in the brain and rupture the vessels supplying blood to the brain. This is the most deadly form of stroke. It may result from a weakened blood vessel due to atherosclerosis and severe hypertension. In some cases, strokes may occur suddenly and are short-lived. These are called transient ischemic attacks. They usually cause some neurological symptoms like confusion, paralysis, difficulty in breathing. Stroke risk factors are similar to heart diseases like hypertension, high LDL, diabetes, physical inactivity, cigarette smoking, aging, and a previous history of cardiovascular disease. Stroke is preventable, can be managed by intensive lifestyle changes. The damage stroke causes depend upon the brain-affected area, speech, sense, and body movements. You can manage stroke with nutritional therapy. The main objective of nutritional therapy is to maintain nutritional status and overall health. The first and foremost step is to assess the eating disability of the patient. Dysphagia or difficulty swallowing, and difficulty with speech are some of the complications associated with the stroke. Sometimes, tube feeding is necessary to maintain a constant nutritional status. In other words, eating healthy well is the key. Intake of red meat, processed food items, sugar-sweetened products, and unhealthy fat consumption has increased while the fruits and vegetables consumption had drastically decreased. According to American Heart Association, less than 1% of Americans consume a healthy diet. The dietary approaches to stop hypertension, DASH, eating pattern emphasized eating many fruits and vegetables, whole grains, low-fat dairy, less red meat, nuts, legumes, fish, and poultry. People at risk of stroke should have a high intake of fruits, vegetables, beneficial oils like canola oil while limiting their intake of red meat and other unhealthy food items. Avoid deep-fried food products and hydrogenated fats like trans fats, seldom meat, mainly poultry and fish, only whole grains. Limit salt. Managing your blood pressure and cholesterol levels is also essential. Dietary approaches to stop hypertension, DASH, is a heart-healthy diet. It can lower your risk of having a stroke. The biggest thing is to limit your processed food items. Following are some of the strategies that can reduce the risk of you having a stroke. If you are enjoying this video, please subscribe to our channel. Subscription is totally free by pressing the subscribe button. Also, hit the notifications bell so that you will always be notified of new content on our channels. 1. Eat a variety of foods. No single food item can provide benefits to our bodies. Adding various food items from all the food groups is essential, as suggested by the dietary guidelines. 2. Eat colorful foods. Getting the right amount of nutrients is very important. By choosing a rainbow approach, you can nourish your body and lower the risk of developing any disease. 3. Fruits and vegetables. Fruits and vegetables are packed with heart-healthy nutrients. Research has shown the health benefits of consuming plenty of fruits and vegetables. They may also lower the risk of having a stroke, cancer, and other cardiovascular diseases. A meta-analysis of cohort studies with 469,551 participants has shown that a diet rich in fruits and vegetables reduced the risk of cardiovascular diseases. People who consumed an average of 8 or more servings of fruits and vegetables lowered their risk of heart disease and stroke. Try to eat at least 5 servings of fruits and vegetables every day. 4. Limit your saturated fats and cholesterol. Cholesterol is a waxy substance that is found in the blood. It is used to make healthy cells in the body, but having high blood cholesterol can increase cardiovascular diseases. Too much cholesterol can cause fatty deposits in your arteries and build plaques in them. This can make your roots harder and narrow. High cholesterol usually depends upon 2 factors: how much cholesterol your body, liver, causes and how much you eat in the form of fatty food items. Foods that have high saturated fat content can raise your blood cholesterol. These include animal products like butter, red meat, cheese, and some vegetable oils. Limit your saturated fat intake by replacing them with healthy food choices. Instead of full-fat milk, you can use skimmed or 1% fat milk. Instead of whole egg, you can eat eye whites only or egg substitutes. Diets that are high in trans fats are also high in cholesterol. These include most fried items, many processed items like cookies, crackers. So instead of deep-fried items, choose baked or grilled foods. Instead of crackers made with hydrogenated fats, choose baked ones. Limiting your cholesterol is important, and it is essential for stroke management. 5. Reduce sugar. Excess sugar intake is detrimental to health and is linked to high blood pressure, obesity, and stroke. The Western diet of today is loaded with sugar and salt. Examples include sweetened beverages, jellies, jam, white sugar, and other processed food products. 6. High fiber foods. Foods that are high in fiber are considered to be healthy for the heart. It may reduce your cholesterol levels and overall risk of cardiovascular diseases. Dietary fiber is primarily present in plant-based foods. It affects how you digest the foods and absorb nutrients. It also helps to control the blood sugar, stoke and promote satiety. Sources of dietary fiber include whole fruits, whole grains, fruits, vegetables, brown rice, etc. All refined and processed foods are low in dietary fiber. 7. Enough potassium. Potassium is essential for the proper functioning of the heart. Dietary approaches to stop hypertension, eating pattern promotes eating an adequate amount of potassium. Sources of potassium include fruits, vegetables, milk, spinach, apricots, bananas, apples, oranges, sweet potatoes, etc. 8. Get physically active. Exercise is very beneficial for lowering blood pressure, maintaining healthy body weight, and reducing the risk of getting a stroke. One may reduce the risk of stroke by simply adhering to an active and healthy lifestyle. A meta-analysis of 23 studies suggests that physical activity is associated with a reduced risk of stroke. Physically active participants had a 25% lower risk of stroke. Another meta-analysis confirmed these findings. In moderate to highly active lifestyles, participants had a reduced risk, about 20% of stroke in both men and women. So, eat right, eat wisely, and be happy. Here ends this video on the keto diet and weight loss. Thanks for watching. Don't forget to check out our other videos in this series. Food as medicine. Remember to subscribe to this channel. Goodbye. See you again soon.